So I'm a pediatric anesthesiologist who several years ago, actually before the pandemic, became interested in telehealth and chose to pursue training in it, and it happened to coincide with the onset of the public health emergency. So it's actually worked out where I've seen the explosion of it. One of the things when you become involved with telehealth, just in learning any basic concepts of it, is to recognize that, of course, it varies by state. With regulations and laws concerning the deployment of telehealth. One of the things that you do learn is that the North Carolina, unfortunately, is at the bottom of the country in terms of telehealth regulation and laws. We are, in fact, one of 7 states with no telehealth laws or regulations on the books. Essentially, the North Carolina Medical Board will quote you a statement from the Federation of State Medical Boards, essentially saying that you should be licensed in the state where the patient is located. Unfortunately, this leads to a situation where the development of telehealth is linked to the reimbursement by third-party payers and their particular policies. So go ahead to the next slide. So my objectives and disclosures, I want you to understand the process by which one can take a concept and transform it into a policy of the North Carolina Medical Society. And I have no specific disclosures related to this presentation. So the first thing you do is recognize there's a problem. So as many of you know, I serve on the North Carolina Medical Society's policy committee. When it was formed in 2019, we started meeting essentially to review the policies of the society and to work to bring them in alignment with North Carolina Healthy 2030. That work had been completed in the fall of 2020. And the leaders of the committee, Drs. Gerald and Schock, asked that if there's any ideas or policies that we should be pursuing. And I had suggested telehealth. And then, of course, you thought it would just go in the queue and you'll never hear anything of it again. But 2 weeks later, I received an email stating that they would be very interested in the North Carolina Medical Society having a policy on telehealth, and suggested that I would help lead the effort, and that while we were at it, we could also do a digital health equity policy. So this required me to really develop some self-awareness as to how strongly I wanted to pursue this. I mean, I felt that I was ready and that I wanted to pursue it, but when someone suddenly hands you the opportunity, you have to be ready to accept it. Next slide. So the first thing you do is you become a subject matter expert. Now, at the time when I accepted this, I was in a graduate certificate program through Thomas Jefferson University, Connected Care, Telehealth, and Digital Innovation. But it also required me to step up to the plate on telehealth advocacy. The Center for Connected Health Policy is a federally funded, nonpartisan nonprofit, which basically examines all telehealth policies through the country and compares them. In addition, the National Centers for National Telehealth Resource Centers divides the country into regions. North Carolina belongs to the Mid-Atlantic region, and they too will examine policies, and they actually will hold annual meetings where you can meet other telehealth experts. The second thing is to facilitate the learning of others. So I had all this knowledge, but I had to be able to share it with others and to bring others up to speed. The staff of the policy committee of the North Carolina Medical Society needed to be able to direct them to resources so that we could look at the policy and how best to develop it. And then also realize that others may see the very same information you do, but through an entirely different filter. And so what you feel is important, they may not, and what you think is something that's insignificant is of great consequence to them. Next slide, please. So when we were first putting together the work group within the policy committee, one of the first things we thought was that we needed to have more information, particularly since the committee was heavily weighted towards primary care, and we wanted to get the perspectives of other members of the medical society. So a survey monkey was sent out on the morning rounds email, We received around 140, 150 replies, which I was informed was pretty much baseline for surveys that the society conducted. And then interpreting the data may be a learning experience for you as well, because again, this falls into the perspectives of others. You would see the North Carolina Academy of Pathologists basically asking if Store and Forward could be paid for, because that is what they do. Is they gather slides, they send them out for consultation to be reviewed by others. And up until now, that's been something that was just done just out of intellectual curiosity or to be like a social service. And the ability to be able to bill for that would greatly enhance that capability. In addition, we had a letter from the North Carolina Academy of Family Practitioners, specifically warning against allowing national companies that practice telehealth, not allowing them into North Carolina and requiring that the provision of telehealth be tied in to the patient-centered medical home. And again, interpreting why you're hearing that and what their perspective is and why they're concerned about it is fundamental to understanding and getting everyone to work together. Which leads to the third point. You need to establish what's important for everyone, not just for your specific group or your specific perspective. What is going to enhance the telehealth throughout North Carolina for everyone, using the analogy of a rising tide raises all boats. Next slide, please. So again, revise. There were constant meetings. The policy committee meets quarterly. The work group was meeting every week or two between quarterly meetings, revising, looking at the information we'd received, revising again, adding things, deleting things. It required a great deal of patience, a lot of resilience, particularly because you would see a topic and it would come up, you thought it had been addressed. Well, then at the next meeting, it gets brought up again by someone who didn't attend the previous meeting. It basically requires you an acceptance of the process. Forming a policy is basically a concept that requires getting a lot of folks to work together. The herding of the cats. A favorite quote is that a camel is a horse that was designed by a committee. And in some ways, this is intended as derogatory, but if you think about it, for the circumstances of which you need it, a camel is a marvelous animal. If you're in the desert, a camel is what you need instead of a horse. And so the idea, though, is to be able to guide the process, not directing it, but more of like helping people to form a consensus and being able to listen to each other. We, after revision 4, we were able to the committee leaders presented it to the board of directors in March, where it was promptly tabled due to time, and they reviewed it and approved it in May. They actually did some wordsmithing, some parsing, and decreased the policy to make it a nice, simple statement, which is available on the North Carolina Medical Society website. Next, please. And then just a couple points. The North Carolina now has in the budget there was a bill, House Bill 149, for which I advocated. I attended some White Coat Wednesdays. I actually even hijacked some anesthesiology in May as our big advocacy month, where we lobby folks federally and in the state. And I was sort of known as the telehealth doc because I would basically in the middle of an anesthesiology discussion about surprise billing, bring up telehealth and how important it was. But my sincerest thanks is to the society, to the other members of the policy committee. And without their hard efforts and work, this would have been impossible. And special thanks to Kristen, the director for Health Center Innovation. She was tireless in taking my undisciplined thoughts and statements and helping to form them into a coherent policy. And for those of you that are curious, the bill passed the House with no problem. It was stuck in the Senate, unfortunately, due to opposition from third-party insurers. It was put into the budget and was being negotiated on. The budget, unfortunately, right now is under lockdown because it's being negotiated with the governor. So there's no way to know if it's going to make it through the process, but we hope to know soon. Thank you. Now I'm open for questions.